Thank you, Schengen. It's, yes, our first time. So we all need to get used to not having those big pillars we used to have. We don't miss them very much, right? So yes, this is a big event, finally putting all our work on Alive and Thrive together, bringing our partners and the leaders in this impressive project. Alive and Thrive, I was having difficulties figuring out when exactly it started, and Purnima just confirmed that it started in 2008, so it's almost 10 years old. And it started with the vision of one person, I have to say. This is the vision of Ellen Piwas. Ellen was nodding. I don't know whose vision she thought we were going to talk about. But her vision to promote a project that was based on improving behavior change and communication. This was not very fashionable at the time. It still isn't. But we're getting a little bit closer to that. It is most impressive even to have pushed through this project, which is on behavior change communication, in a donor institute, a donor foundation that focuses on innovation and technology. Behavior change is not perceived as a technology, although it would make it more sexy maybe if we could do that. But Ellen saw that we had to try this. We had to try a large project where we implement behavior change communication at scale to improve infant and young child feeding practices as a way to improve child stunting. So with Ellen being behind championing this project through, and the team that she put together, the team that was selected through a competitive process, FHI 360, which was then AED, was selected. And we had Jean Baker as our guru. I'm very disappointed she's not here today. She retired a year ago or so. Jean has taken this project through all its ups and downs, to the 3 countries, managing 3 countries, Ethiopia, Vietnam, and Bangladesh was really challenging, managing a large team of partners and managing the researchers, which is IFPRI's role in this project. So it has been quite an adventure. Alive and Thrive is alive and very well. It has a new, it is evolving in new directions, in new countries. It's scaling up even more than ever. And this is some things that Ellen probably will tell us about, how basically the project and the results of this project have given the momentum to behavior change communication in a way to improve nutrition. So we will talk about the results of the first phase. Purnima will talk today about the results of the first phase. We will have some discussions about the program and policy implications. What has this project achieved in terms of new models for programs, new ways of implementing BCC, new platforms, and how to take care of context when we design these interventions and these programs, especially at scales. What are the lessons learned, and what are the lessons learned for policy as well? So without further ado, I will introduce our first speaker, Karen Lapping. Karen was part of the people that started this project. She was at Alive and Thrive at AED at the time of the beginning of the project. She was actually seconded from SAVE, if I remember well, and worked on the project for many years. Then she went back to SAVE as a director of nutrition for a few years and missed Alive and Thrive too much. She came back as project director when Jean Baker left. So Karen will tell us about what Alive and Thrive is, talk about the 3 countries and the strategy and the theory of change of the project.